Hi, good morning, everyone. Welcome to 124th session for live from CMAAO. This is a platform where we all connect together, share, discuss what's going on. Before we make it live, we were discussing about, uh, what's the problem which the medical industry is facing. It was a very, very interesting discussion between Dr. Chong, Dr. Salma, Dr. Bukhari, Dr. Muzukwi, Dr. Akhtar, and Dr. Kazi joining in from different countries. So I welcome on board. We were discussing issues which have been faced by the hospitals, by the doctors, by the industry today. We don't like the staffing issue, the backlog of the patients, the COVID issues, all those things were there. So I will let Dr. Chong, who is the chair for CMAAO, to start the session to talk about it, and then we can all discuss about it. Over to you, Dr. Chong. Welcome to the show.
Thank you. What we're facing here in Singapore is quite trying. We've never seen anything like this before. In Singapore, we have a private sector and a public sector. I'm in the private sector, and we have several big hospitals here. We have 4 private hospitals here that are very big, and doing most of the heavy lifting. But what we found is that, for example, just today is Saturday. So on Thursday night, my patient had very bad diverticulitis and needed to be admitted to hospital. And there wasn't a bed. The 3 hospitals were full. And the waiting list for one of them was 11 patients ahead of me, of my patient. So what we're seeing here in Singapore is that there's a massive, of course, we have a massive return of our medical tourism. So that's one. But other more important considerations is the fact that a few thousand of our nurses from the private sector have actually resigned. And because our nurses here in Singapore speak English very well, and well trained and so on, so they've been poached by first world countries like UK, US, New Zealand, Australia. And these countries have offered them permanent residencies. And the US has offered green cards, and also the ability to bring their families. Because in Singapore, some of our foreign nurses are not allowed to bring their families here. The pass is only for, the work pass is only for themselves and not their families. So we've faced a huge shortage of nurses in Singapore. And our biopsy list, our endoscopy list, our OT list, our MRI list, our CT scan lists, and so on, have all been lengthened. If we go to a public sector hospital like the emergency unit, some of us, there's a holding area now in every public sector hospital with beds at the emergency units. And the patient can be inside there for 48 to 72 hours before they get into the hospital. So some of them are discharged from that place. Problem solved in 2 to 3 days. So these are some of the issues we're facing. And on top of that, I think one of the big problems we've faced is because our elderly population over 2 years of COVID have been deconditioned physically, muscle mass loss because didn't go out, didn't interact, cognition loss. And so we're facing a lot of these huge deluge of work and backlog and shortage of nurses and difficulties in fulfilling our responsibilities. So I'm just curious as to what's happening in your country. And one of the interesting things I also remember after SARS in 2003 was that there was a lot of resignations from the medical industry because people were truly frightened of they've never seen anything like that, where you go to work and you can catch a fatal disease. So, over to everybody else, whether they have any similar experiences to share. Dr. Bukhari?
Oh, I think thank you very much for your updates about the COVID. And what have you mentioned? Actually, last 2 weeks I was out of country, and I visited more than one countries, especially the Arab countries. The same situation is there. The people, basically, the peoples are not caring, and the people are now they have making the friends. The COVID has become their friends, but it is much dangerous for the people who are weak immunity. And as a doctor, what we are looking in Pakistan and other countries, there is no infectious ward in any of the public sector hospitals, especially in the teaching hospital, that we have advised our government that they should permanently establish, because we are facing not this pandemic, we have seen some other monkeypox, we have seen other infection and a future other infection. One thing is that what is the burden? How can we reduce the burden of this COVID? We all have seen economically burden in we Pakistan. We have faced our dollar is rising many times. That is due to, I think, from the last 2-3 years of the COVID. And the thing is that and not as a doctor, as a scientist, what I think is that there should be a permanent solution, the awareness of the people. Today I was looking, there is more than 500 cases, new cases, 4 deaths are there. And about 300, more than 80 first doses, and around about 300 millions doses, complete doses, and about 30 million booster doses. But still, what I was thinking, last day I was in my office and I called my PS. Where is PS? Oh, sir, he is not here. Why? He is suffering from the fever. I asked him, have you sent your sample for the PS? No, sir, I have not sent the sampling. I stressed him, and imagine that my PS was positive for the COVID. So these are the things that we have to. This is a very beautiful platform that you are raising the awareness from the last so many days, so many years. And I will appreciate you people, and I will also advise you people to bring the scientists in this forum monthly or bi-weekly, to create the to search the permanent solution of these infectious diseases that we are facing. And the third thing is that I always advise my students, my friends, that try to keep your immunity boost. And boosting of the immunity can only remedy to against any of the infectious disease. Thank you so much. Now I think over to you if you have any question about. And another thing is that monkeypox, that we from you created awareness, and I think this was blessing for our countries, Asian countries, that we become more aware, and blessing of the Almighty that we are not facing monkeypox as it is in the Europe. Thank you so much, sir.
Thank you, Dr. Bukhari. Dr. Akhtar, have you got anything to update us on your situation in your country, whether is it COVID or your difficulties you're facing in your healthcare system?
Thank you, Dr. Chong. Good morning, everyone. Yes, the situation almost like what you have presented in Singapore. We are facing price hiking, shortage of staff, medicine, not available sometime, and also especially the doctors shortage, because a lot of poaching happening in Ireland and UK.
Yes.
So they are leaving. Even Canada also taking our graduates, even the fresh graduate, they are going. So, and national government in South Africa, they're having a funding issue, especially post-COVID. They cannot have enough budget to recruit more nurses and doctors. And apart from the hospital, public and private hospitals are full. with the chronic and other diseases. As you said, they have to wait some time. It's very true. And sometimes surgical cases are getting delayed. Oncology's cases are delaying because it's not emergency. And public hospital situation is always, even during COVID, we face a lot of crises, and that now all the blame go to the COVID has taken the budget, eaten up, like shortage of fund, and other issue of petrol prices going up and up. I don't know. So that is also affecting daily life. And what happened? Tuberculosis and other chronic disease follow-up was disturbed because of the COVID. Now they are coming with the advanced stages. So that's another problem. So post-COVID, long-term is not only the post-COVID patients suffering, the other disease. We were about to control tuberculosis 80%, 90%, but now you're back to zero. And since masks and all gone out of the from the what you call follow-up SOP, the different different influenza or RSV virus are increasing. Numbers are now increasing, so people are getting sick. And in South Africa, it's a winter and also raining, and that also causing problem, flooding, and waterborne disease are coming up. So it's just a vicious cycle we are facing. Thank you, Dr. Chong.
Thank you, Dr. Atta. It sounds so familiar. You know? We're facing all these, and in Singapore, for example, we have a very strong control of our tuberculosis patients. But recently, we had a block of flats where like 70, 80 patients had 70, 80 people in a block of flats had tuberculosis. So they've sealed off the whole flat, the whole block of flats, and then they made everybody in the surrounding region screen for tuberculosis. So unseen, we've never seen this sort of thing before. You know, because COVID has pushed aside all the diseases for 2 years, and then maybe the herd immunity has dropped or whatever, and all these diseases are all coming back in a very fast and furious way. So influenza, monkeypox, tuberculosis, dengue in Singapore. My God, we're really facing public sector, public health challenges.
I have a question. Are you guys facing any noticeable a decrease in the living age bracket after the long COVID? I've seen, especially in India, a lot of young deaths are happening now, which may not be termed as a COVID effect, but it's, you know, people have a tendency to speak, oh, you know, it's too early for him to go, and somebody doing a treadmill, somebody's just walking around, you know, and suddenly there's a heart attack, suddenly there's a cardiac arrest, suddenly there is some issues, and it land up in the hospitals. And it may not be a long COVID effect, but it may be also a long COVID effect, which was not there before. So probably the average age bracket of person, I think, is going down. Maybe because of the lifestyle, maybe because of the work burden, stress. I don't know. So is that something which anyone has also noticed? Also include that in your discussion.
Yes, I think, Sarab, you're right. I think there are a few things about COVID that we still don't understand. For example, one of them is what COVID has done to our immune system. You know, that's something we are not sure, you know, we're not certain. So probably much later we'll figure out what's going on. So some COVID has done something to all our immune systems, that's for sure. Of course, the anti-vax will start blaming the vaccines and so on, but I think COVID itself has probably a tremendous effect on our immune system. Secondly, the amount of stress that we went through for that 2 years, you see, one of the biggest issues is that in that 2 years, we actually had a lot of losses. So we lost our freedom, we lost our travel, we lost our economic loss. There were all kinds of losses. A lot of people lost their family members. So there's grief and so on. So I think the amount of stress during the last 2 years is something that is very difficult to quantify, right? Because there were all kinds of losses. I know the whole population went through a grief reaction of some sort, anger, denial, bargaining, sadness, finally acceptance. I think
No,
there are some
absolutely, you're
big
right.
factors here that we cannot measure. We cannot measure, and therefore the effect is, difficult. And for chronic diseases and so on, if the healthcare system is overwhelmed, then a lot of healthcare diseases, chronic diseases are not well looked after. A lot of surveillance for ongoing infectious diseases may be curtailed. So I think you're kind of facing this is a post-COVID period, but but we're seeing a lot of challenges left over as a result of COVID. We're seeing a lot of challenges coming fast and furious.
Okay. So should we can I invite Dr. Muzukwa from South Africa to speak on the topic? Dr.
Yeah,
Muzukwa?
no, yeah, good morning, colleagues. Yeah, no, the issues that you are raising, honestly, are issues that we are also facing, like Akhtar has alluded to earlier. I mean, just recently, there is an article that has been out there speaking on the issue that we are talking about today, where in some areas in the Eastern Cape, doctors are complaining about, the foundering, the crippling staff shortages, broken equipment, basic drug stockouts, emergency surgery delays, specialist doctor brain drain. When it comes to this issue of brain drain, I'm not sure if it's an appropriate term, because what, like our colleagues are saying in Singapore, foreigners are not allowed to come in with their families.
Yes.
How do you expect that person to be permanent in and love the job when the family is not there? So it's the same thing. I mean, people will go where it is, they find a comfort. Even in our country, you can't expect doctors, blame healthcare workers who are going out, to preserve their profession as well, to go out and practice somewhere else where conditions are made better. If you have all these things in South Africa, how do you expect, people to wake up still to have that love to go back to work, and give their all, their heart into the work, when you have got broken equipment, when you have deaf ears, people who can listen to you when you complain about these issues, or even when you come up with solutions to say these are the issues that we have picked up, when we deliver services, but you find, they are not attended to. So what do? There will be a continuous lack of nurses, and there'll be a sharp rise in the neonatal death rate and all these things that we have seen. So this is what is happening in the country, and I don't think that is only limited to that part of the country. It is just that we do not have data around the country to tell us, how many people have left the country. But I believe that they have left the country only because there are these circumstances on the ground that are making it very difficult for them to practice medicine. So I'm really worried about, our health authorities not attending to issues that are so critical, and as the South African Medical Association, I think, if I'm not mistaken, Akhtar will correct me, I think back in 2019 or so, in fact, way back before that, we've been always informing government that there are people who are leaving the country, because they want to practice where their needs are taken good care of. And we were saying to them, attend to the needs of healthcare workers in the country, continue training, but don't only do that, allocate them to the hospitals. They must have funded posts and all these things. There must be good equipment, for people to work, attend to the working environment. But that has fallen on deaf ears. So that is why now you are seeing these people leaving the country. I don't personally blame them. So that's the state of the country at the moment. Thank you so much.
Thank you, Dr. Mazuka. I couldn't agree with you more. Our problem here in Singapore is the nurses, because a large number of our private sector nurses are actually foreign, for example, from the Philippines and surrounding countries. So these nurses have actually been poached by first world nations because they all speak English. So well-trained, speak English. So unfortunately, and one of our silly policies is that they were not allowed to bring their families. So what can I say, right? So they go where.
Adding on this, even like I understand you, like there have been like all these nurses and everybody is like trying to get it from the countries like Singapore, where the nurses are good, they're experienced, and they have a English speaking standard. But also have a keep in mind that even US and Canada is facing a big time shortage of the nurses, and it's not because of what happened in COVID. What I noticed, a lot of people went back. They were being fired during the COVID times, and a lot of people were old age people. They were mature nurses. They never came back to the work.
Yes.
So also my question to you guys is there a big shortage? Like, I know airlines industry is a big mess right now. Hotel industry is a big mess. They don't have to provide you service unless you asked for it in the hotel industry. Health industry cannot work without a service. Like, in terms of, you can't just say, okay, you have a heart attack, okay, come back later. I don't have a staff. You have to serve. It's an emergency. It's an emergency thing. How much it is getting suffered? Because I understand over here in US, the doctors have a waiting time of almost a year for an appointment, because there's no staff. They don't have an option.
Yes.
And so there's a big change in the industry which is going on. There's a big change in the scenario which is going on. There's a big I don't know what you say, but it's like something which we have not ever seen before. So it's a very important topic, and trying to understand what is a message we can deliver to the customers, not really customers, but the patients, what can be delayed, what cannot be delayed, but because this is something which I feel that people are getting affected and they're losing life also, and nobody's to be blamed. Yep, over to you.
I think there are many reasons why. For example, I can't. Our doctor attrition is not so bad, but I think there are for the nurses, I can tell you that there are many reasons why a lot of them have left. So the main one is because they're getting a better deal elsewhere. Two, a lot of them have really suffered for 2 years. They have not seen their family members back home, so they are actually taking a break. They are resigning and going home. So they're going home to where their families are, probably take a 6 months break or something. Then the other phenomenon we see is actually people after a big event like SARS or COVID, asking themselves, why am I doing in the medical industry? Why am I putting myself at risk, blah, blah, blah. And the fact that the medical industry is a risky place. So they decide to leave for permanently or temporarily, we don't know. So there are actually many, many reasons why we have a massive shortage of nurses. We have probably estimated 2,000 to 3,000 nurses are short in Singapore. So there are many, many reasons, but I guess they all piled up together and cause a big crunch right now. And of course, most of them were not laid off because we needed every hand on board. But I think just the sheer intensity of the last 2 years have made a lot of them take a break to, or take the excuse to go back and see their families and so on and so forth. And some of them have not seen families in 2 years. So there are many, many reasons, but it's all come together at a bad time. Anyone has any experience with
Dr. Chung,
what's
can
happening in their home countries? Yes, Dr. Bukhari.
can I, Dr. Chung, can I talk for 1 minute? Dr. Chung,
Sure.
can I talk?
Yeah, go ahead, go ahead.
Oh, thank you very much. The reason of shortage of these paramedics and nurses in Pakistan, one reason is that brain drainage. And the second reason is that if I compare the medical schools uh, producing the doctors in private and public sector, and if I see the schools of nursing schools and paramedic schools, the ratio is 1 into 100. So that is why our public and our private sectors must concentrate on these issues. They should not only produce the doctors, consultants, physicians, surgeons, but they also uh, develop the schools, the universities for the nursing and paramedics. That is the main two reasons in the Pakistan that we are getting shortage of these things. Doctors, consultants are no doubt very important, but our paramedics and our nurses, these are very key important persons who helped in this COVID, not only in the COVID, but in the world. So that I will request on this platform that we should give the suggestion to the private and public sector that we should make the health industry, and they should develop these para things so that we should not get. And the third thing is that the security, the the security, especially in the rural areas in the Pakistan, is very poor. That is why the female nurses are reluctant to work in the rural areas of the Pakistan. So these things are not difficult to control, but the policy should be health friendly in all countries. Thank you so much, sir.
Dr. Qadhi, are you available?
Thank you, Saurabh. I was just listening to what Professor Bukhari was telling, and of course, he is right that we do have a shortage of paramedics and nursing staff, and then of course he pointed out a very important issue of security to these people. Like in the polio vaccination campaign, there have been incidences where these were, put on a in a vulnerable situation, and they faced some fatal, incidents as well. So it is definitely there. We do have shortage of, paramedics and nurses. Uh, of course, our paramedics and nurses do not, employ themselves overseas, but we have lesser production of these staff. And regarding your bracket for, lower age or early deaths, we don't have the data available, but definitely I've seen in my families, younger one, going early from this world. So that is very important point you have raised, and it may be due to post-COVID, situations. And regarding, as Dr. Salma Kundi has pointed out, that we can have a monthly meeting, that would be fine, because weekly is too stressful. I think, Sarab, you can consider that fortnightly or, monthly meeting. That would be fine. But it's an excellent platform to interact, to know what's happening around, and to meet each other. That's wonderful. And we had very heavy monsoons torrential rains in Pakistan, and we have urban flooding, and we are at the moment facing those waterborne diseases, and we are anticipating to deal with those, gastroenteritis, cholera, and things like that. So dengue is also there after those rains, and the mosquito breeding is there. So that is the situation here. And of course, as Chong has pointed out, that hospitals are overburdened. They're working heavily. I mean, the patients are coming up. There are patients lined up, and there are definitely waiting lists for the surgical procedures and everything else. So, that's the situation here in Pakistan. Thank you.
Do we have anyone else who wants to share their opinion or views over here? We can open this forum for some of the people whom we are not able to recognize. Yeah.
I think, Sarab, if we are not having any more contributions, I suggest we close this meeting, and we have a discussion next Saturday at the same time. And I'll catch up with you on what we need to talk about.
Absolutely.
When you're back in India.
Yep. Thank you so much. So I will be in a better time zone next week, and we can, I respect with the medical, I stay with a lot of medical people, and I'm in touch with a lot of medical, and I know the pain you guys are facing. So I bringing also people over here is big. Everybody's very busy, and I think patients are always a priority for everyone. These online forum educations can continue. So with this note, I would thank you for all the members to join in, and we will talk offline how we can move it forward. With this, we will have again a session next week. And till then, thank you everyone for joining in. We will bring up a different topic, different discussions. Today we discussed about issues faced by health industry, or maybe we can continue on the same issues, and we can have a pre-notice to everyone so that they can talk about this issue. Thank you.
Thank you. Thank you, everyone. Thank you very much. And I look forward to seeing all of you in Karachi.
Thank you very much.
Thank
Oh,
you.
yes. Welcome to, we'll see you in Karachi.
Oh, great. I'm really looking forward to it. I'm planning my flights these couple of days.
Don't make me jealous. Take care, bye.
It's an open offer. Anybody else can build. They're most welcome to join. And it was wonderful to see Chong, giving us the green signal for his coming to Karachi. It was wonderful.
Definitely showing up. Beautiful. Looking forward.
Oh yes, and the traveling is quite smooth.
Yeah, I'll be flying via Dubai. So what I'll probably do is come in on the 21st or the 22nd. A few days, couple of days before we start, and then I'll leave on the 26th after the dinner.
Okay.
Fly out after dinner, and then I'll probably stop over in Dubai and stay one night in Dubai because I've never been there. So something like that.
That's a nice place to stay. I would say you give a couple of days.
Is that right? Okay. I don't have enough time.